Clarke, you've studied the lack of efficacy claims quite a bit, especially in some of the work that you've done going into clinics and evaluating cases. Can you give us a little insight on what you've learned from that, as well as some of the data that was presented yesterday?
Yeah, I mean, this has been a blockbuster meeting. I mean, we debated whether there was resistance for years, and people have worked hard to figure that out. And it looks like there are resistant strains of Dirofilaria immitis now. That is a warning for us that we need to be careful. There's some disagreement of whether they've been produced by our therapies or not, but take-home point is we probably do not need to be given macrocyclic lactones to dogs that have heartworms, and if we are forced into that position, then we need to make sure that the microfilaria are gone, and that can be done with multiple ways, but maybe the most convenient way is to use a combination of a macrocyclic lactone and doxycycline. I think another point that was brought up over and again is that this is not widespread. It appears to be in the Mississippi Delta, and ironically, it has not only plateaued, but the problem seems to be falling off some, and it's hard to know. It's not seemed to have spread from there, but it's still a worry. But every presenter emphasized that there is no reason to believe that these drugs don't work, and we need to use them exactly as they are prescribed, as directed by the manufacturer, and probably should be given year-round to dogs in any endemic area for heartworms, and that we should check these dogs yearly. Some people are even suggesting biannual checks for heartworms. I think that's a little excessive possibly, but so we're going to need to know when dogs get heartworms and get rid of them, and we need to make sure we're using the preventives exactly as directed and as aggressively as our clientele will allow.
Do you have any concern that the evidence now that resistance probably does exist is going to steer the focus away from compliance and have people looking at it from the aspect, oh, it's resistance, so we can't do anything about it?
I'm happy to say I think that was a concern and probably should still be a concern, but my observation is that most veterinarians are working at improving what they can improve, and I think that's part of why it's dropping off. So hopefully not, but I would urge anyone who happens to see this interview is that we need to use them. This is not a warning not to use them, it's a warning to use them correctly. I'd also like to say, in my opinion, this is a multifactorial problem. It's not due to drug resistance. In fact, I'm not sure that the world will agree with me, but I think that what's gone on in the Delta is maybe only a fraction of that problem is due to these resistant strains, and it's many other things. And the fact that it's dropping off, I think, has to do with better veterinary and client communication, that maybe people in the Mississippi Delta are starting to house their dogs indoors at night to minimize this just incredible exposure that they undergo if they stay outside all night long, getting dogs into screened porches or screened enclosures. Those sorts of things I think are really important, and so I personally think that we can overemphasize resistance. I mean, compliance, compliance, compliance. Our data would suggest that compliance plays a role in well over 95% of the cases of heartworms, and that resistance, we don't know of one break that was truly due to resistance. I think they probably are there, but it hasn't been proven exactly that way. So the compliance is what we can do something about. With compliance, we will hopefully stop the spread of resistance. So I think that compliance is the most important piece in that puzzle.